Well, hello and welcome again to another episode of the Coronavirus Chats brought to you right here on the Neuse platform. I'm your host, BJ Murphy, publisher of Neuse.com, and just want to say a big thank you to everybody who's tuned in to these chats. We've actually even created a full playlist of these both on our Facebook channel as well as our YouTube channel, so feel free to go back and look at all of them. The only thing I think I would caution you with that is that because this information is moving so rapidly and changing almost daily, if not on the hour, that some of the advice, medical advice, and some of the issues surrounding the school systems and things have changed over time. But if you just want some good practical advice to kind of see what we've done here on a local level, feel free to go check out those coronavirus chat playlists on Facebook or YouTube. And just want to say a big thank you to everybody who's watching. We've got Dr. Pradeep's going to be up here in just a few moments. Please make sure you go ahead and share this broadcast. And if you have a question for Dr. Pradeep, please go ahead and put it right here in the comments below. We certainly want to make sure we get to those as time permits. As of this morning, 11 o'clock this morning, the North Carolina Department of Health and Human Services reported 2,585 cases of the COVID-19 with 31 deaths across our states. We still have 7 cases in Lenoir County, 6 in Greene, and 0 in Jones County. We also reported last week about spring break is coming up for the public school systems, and there's been some challenge about how to handle the food preparation. Just so you know, we do have confirmed that Jones County is not providing meals during that time. There's a couple things you can do. You can contact the filling station in Jones County, and if somebody wouldn't mind, tag the filling station, if you don't mind, in the comments as a resource for our neighbors in Jones County. In Lenoir County Public Schools is going to be providing meals for the spring break week. They're working through some challenges on that, but more information about that is going to be coming in the next couple of days or so. Also, there's been a big topic across our country about help for small businesses and nonprofits. There's a couple of major pieces that I want to at least mention to you. Certainly, you can go to SBA.gov. There's some really great information there about it. But 2 main pieces of parts of the legislation that I want to mention to you. One is that there are some COVID disaster loans through the SBA. It has a max loan of $2 million with a $10,000. Pretty much, it's an emergency grant. It's pretty much a forgivable piece to help with maintaining payroll, rent, and more. The second program I want to mention is called the Paycheck Protection Program. It has a max of $10 million with 8-week forgiveness for payroll, rent, and utilities. Some similarities there for the Paycheck Protection Program. Please contact your local financial institution. I know a lot of the big banks and local community banks have been working through trying to get the applications, the process started. Either they did it on Friday or they're going to be doing it the first of this week. So if you are a small business, a nonprofit, please make sure you reach out to the SBA or your local financial institution. It's really important that you find a way to maintain during this next 6 to 12 weeks or so. And then hopefully once things kind of get really back to normal, you haven't lost much other than a little bit of time. But the government was really concerned about the economy, and I agree they should be. Thinking about the next 2 to 3 weeks, and maybe longer, we are expecting a lot of breaking news to happen, unfortunately related to deaths or changes in policy, to you name it. And maybe we'll talk about education, some other things, but look, if you want to get some of the latest breaking news, we started a little over a week ago a breaking news text alert system. We've got close to 800 people signed up for it already. All you've got to do is text the keyword, as you see it on the screen, NN to 484848. Just text the keyword NN to 484848, and we'll get you signed up for that. The last thing I want to mention before we go to our special guest is LCC, Lenoir Community College. They're really here for you during this time. You can go to their website, lenoircc.edu, to get updates on COVID-19 and how they're preparing. And they also have this very special public service announcement for you. and thank you, Lenore Community College, for that message. And I really am happy to be joined by Dr. Pradeep again, who is no stranger to this show as well as our community. He is a cardiologist by trade, but has been studying the statistics and helping our community get more information about the coronavirus, COVID-19. And so, Dr. Pradeep, to kind of start off, this past week, you posted a picture of your daughter, and you said, and I'm going to quote this because it meant a lot to me as a father as well. When some of you comment that talking about this virus is similar to the flu or H1N1, I would like to scream, but I don't, because lately I've learned to use some self-control. We as healthcare workers have to go home and face this, and you got this beautiful picture of your baby, so don't push it. And as a dad, I really understood that. Please explain a little bit more about your thoughts on this beautiful picture of your baby. Talking about this virus is similar to the flu or H1N1. Again, I would like to scream, but I don't, because lately I've learned to use some self-control. We as healthcare workers have to go home. And you got this. Did we lose Dr. Pradeep? There you are. Go ahead, sir. As a dad, I really understood that. Please. I would like to scream, but I don't, because lately. All right, looks like he was having.
Can you see me? Can you hear me?
Yes, sir. We can see you and hear you. Did we lose Dr. Pradeep? There you are. Go ahead, sir.
Can you hear me? I can't see you on my computer.
Okay, go ahead.
Can I leave and join again? I can't see you on my computer.
1 second. I'm trying to get it. We had this set up. We just had a little technical challenge. I'm waiting. There you go. All right. Well, while we wait to get that back up, just a second. Just give me just a second. I see Dr. Pradeep is sending me a message, and they sound like he was just having a little bit of technical challenge. We'll get him back going in just a moment, while I wait for Dr. Travis Town to help us with that on the back end. It's kind of challenging when we're live to balance all that. So he's going to come up, and I've seen a couple already. I've seen a couple questions already. Do you agree the next 2 weeks are the most critical? Have any of the cases in Lenore County been due to a community spread? The 7 in Lenore, what areas? So I've seen these questions. We've noted them already. We'll make sure we get them back up. And we're waiting on Dr. Pradeep to join us back again. But while we're waiting for him, a couple things I want to mention. Each day, the North Carolina Department of Health and Human Services updates the latest on the COVID-19, and we publish that information for you. We've actually got a partner at East Carolina who's also supplying more information for us. He can see us now. Who's actually supplying a map for us as well. So we've posted that a couple of times. There he is. Dr. Pradeep, can you hear me okay?
Yes.
There you go. All right, put your camera down just a tad bit, and we'll get. Okay, let's go back. You posted the other day this beautiful picture of your baby, and you were just talking about how people compare this virus, the coronavirus, to the flu or H1N1, and it makes you just want to scream. And then you said basically, look, I'm going home to this precious little girl right here. Tell us a little bit more about what you meant.
So what I really meant was, people try to lower the importance of this virus, and you can see a lot of people posting, there are 12,000 deaths in the United States, but 40,000 people died in a car accident and all of that. I mean, you cannot compare one to the other. This is a way more serious thing to be talking about. And they always compare with the H1N1 virus or, the SARS and all of that. No, this is completely different. We are not talking about what is happening now. We are talking about the potential of what can happen. So, and most of our, most of the healthcare workers can identify with me. And they say when they come home and say they see your child holding up something like this, she's very perceptive. And, when when a normal regular person goes home, they're talking about, this is a lot of trouble for them and things like that. When we are at home, we are on the phone talking about how bad this virus is and all of that, and we don't realize that our children are listening. And I should have thought about it. When she was 3 years old, she dropped a sippy cup on the floor and said, "Oh, and then I'm going, oh crap."
Right.
She was very perceptive when she was 3 years old. So now she's very perceptive when I talk about the virus, to the point that she really does not even want to go outside. And when she says, if I want to take her for grocery shopping, she says, no, I'm worried that I might get the virus. And which is what we all face. So she wrote this on her own, and she's very worried that something might happen to me or to my wife, and which is possible, but hopefully unlikely. And that's what we were talking about. That's what I wanted to express. Guys, the social distancing is not about you. It is about everybody else. It's about the spread. And we want to take it seriously. Yes, hopefully this will work, and hopefully this will not be a major deal. But there are a lot of healthcare workers like me out there who are getting exposed to it every day. And we want to come home too. We want to go out and have parties too, but we cannot because of this.
I think it's a really, really valid point. In fact, I watched just a little while ago on CNN. It was a nurse who was frustrated about this idea of seeing people with wearing gloves out in public, and she talked about cross contamination. And she used like simple paint, and she tapped the paint as if she was getting some toilet paper or something, and then she grabbed her phone, and then she wiped her face, and by the time she left the grocery store, she had paint all over her, even though she had these gloves on. And I thought it was just a really valid point about how cross-contamination really works.
Yes, I mean, and that is a significant problem. Some grocery stores, especially in Raleigh and stuff, they force you to wear a glove before you walk into the store. I had to take some groceries to my parents yesterday, so I went to this H Mart, which is a Korean grocery store. The minute you walk in, they wipe down all the grocery cart, and then they will let you in only if you wear a glove. They give you disposable gloves, and on the way out, you have to take it off. I mean, which I thought was really, significant. And then every employee there is wearing a mask. There's nobody there without a mask. So those kind of things does reduce the incidence of transfer. But will it be 100%? No, obviously it cannot be 100%, but it does reduce the risk, and that's what is important.
I want to put a pin in the mask conversation because I do want to come back to that, given the guidance this past week on that. But first, if Travis, if you wouldn't mind pulling up, Dr. Pradeep posted 3 graphs a little over an hour ago on his Facebook page, and they were the COVID-19 cases in the U.S. as well as North Carolina, including another graph on the deaths. There is the COVID-19 cases in the U.S. Can you talk a little bit about this graph real quick, Doctor?
So basically, what I did was for the US and for NC, what we basically did was put down all the cases every day. So yes, the graph does look scary, but the ideal graph to put up would be on a log scale, but that would be hard for people to understand. So that's why I put the direct numbers up there, and you can see it's climbing. Now, what it doesn't show, though, is over the last few days or a week, the doubling has come down. In the beginning, it used to double every 2.5, 3 days. Now the doubling is almost every 4 to 5 days, 4 days or 4 to 5 days, 4 to 5 days, and which really makes the difference, which I'm hoping is because of the social distancing policies that we have all taken. Now, even North Carolina used to double every 3 to 4 days. Now it is around 5.5 or 6 days. So all of that shows that our policies are hopefully working. Now, how long will it stay like that? I don't know. I mean, these are not, the one thing about predictions is they're always wrong.
And there's been a lot of talk about the models.
And if you look at their deaths too.
Right.
Go ahead.
Yeah, go ahead.
And if you look at the deaths too, the same thing. It was doubling pretty frequently. Now it is every 4 to 5 days. So
Hmm.
I'm hoping this is a good sign. But I
And
don't
there's been
want
a lot
people
of
to
talk
take
about
the
the model.
wrong impression out of it. I don't want people to think, okay, now we are good. Let's go out and have a party. And that's not
Yeah.
what it
So
means.
let's talk about the other day. The Dr. Fauci and a lot of folks with the coronavirus task force started changing this national conversation about cloth mask, and there's been a large discussion about face coverings, and even giving some guidance on the Surgeon General even did a video on how to create one out of a T-shirt. What's your take on the public using masks, and what about our supply of the N95, the medical mask for our healthcare professionals?
So, and if you look at the 3M and the FDA has a paper out there showing all the different types of masks and what they prevent. Okay. Now, the lowest form would be the cloth mask. I would say, the T-shirt and all that is probably a little lower than that. Now, it does not prevent the virus from coming in, but it does prevent if you cough, if you're wearing it, and if you cough, it does not. It does prevent it from going out because the large particles will be trapped by the cloth mask. So the cloth mask is not going to protect you, but it's going to protect the spread. It's going to protect other people from getting it from you. So that way, the cloth mask is important. The surgical mask also reduces it by, I think, 30 to 40%, but that's about it. Now, the N95 does reduce it a whole lot. It's close to 95% reduction. Now, the N95, what it does though is it prevents you from getting the virus. So if you are a healthcare worker who is at high risk for exposure, then N95 would be the best way to do it. Now, if all of us had a 95, would it be better? Yes, but unfortunately, we had a shortage with the N95 that should be relegated to all the healthcare workers out there. Now, in our hospital, for example, we are reusing the N95s. I never thought it would come to a time where we would be reusing N95s. Now, back home in India, when I was doing my medical school, sadly, I used to reuse all these masks. But then we were a poor country; we didn't have enough masks at that time. But I didn't expect that to happen here. But unfortunately, we are at this stage right now. So most of us are reusing the mask. Not most of us. We are given two, like for example, in Lenore Hospital, we are given two masks, two N95 masks and a face shield. And as soon as we are done seeing the patient, we take it off, put it in a brown paper bag, and it gets re-sterilized. Okay. And then it comes back to us and we reuse it again. How good is that? Who knows, But
Right.
unfortunately, we don't have
Well, we've got
enough.
yeah, that is definitely an understatement. Let's get to a few of the questions from our Facebook Live audience. One of the first ones is: do you agree the next 2 weeks are some of the most critical that we face?
So yes, the next 2 weeks would be the critical phase because in North Carolina it is supposed to peak at the end of this month. Okay, so the next 2 weeks will, if you don't do the social distancing, if people start getting out early, and I understand the frustration, you're sitting at home doing nothing, so you're more likely to start getting to go out. That peak is going to be a whole lot sooner. And I hope people don't go out. I hope people still stay inside. And then in the next 2 weeks, we'll know how our curve is.
And in terms of Lenore County, I know we're reporting 7 cases, and that could change at any moment. In fact, somebody asked us the other day about were we going to send out a breaking news text alert and for these updated number of cases, and maybe when Jones gets their first one, if they get their first one, but pretty much not moving forward unless there's a significant increase because we actually are expecting more cases. But there has a question about how many cases in Lenore County have been due to community spread. Do you know the answer to that question?
So far, we don't have any community spread yet that I know of. Okay, so far, all of them have been by contacts and by travel. People going to Philadelphia and coming back. Those kind of things are the ones that have happened. But I'm pretty sure it is going to happen. I mean, it's one of these days it will happen. Now, people get so upset over, we need to know how many cases are out there. I mean, in all honesty, other than curiosity, it really doesn't help you. You have to do all the right things anyway. Going there and not knowing that there are 10 people out there really doesn't help you. Other than the curiosity part of it.
I wish you would say that 10 more times, because that has been part of my frustration. And that is a big reason why the picture of your daughter struck home with me so much. And with all the precautions I'm taking and my family's taking, I mean, I feel awful that my kids aren't getting out. So like today we did a picnic outside and, trying to do things where we're getting out at least outside. But, the idea that just because the numbers are where they are doesn't mean that more people don't have these symptoms or are not positive. We just don't know about them yet. There's a question about when do you think we'll have a peak, whether in the United, it wasn't specific to our country or area, but I guess let's talk about the country and then let's talk about North Carolina if we can.
So the peak in the United States is supposed to be in the next 2 to 3 weeks. We are a little behind, thankfully. So we probably, all predictions say at the end of this month is when we are going to have the peak in North Carolina. But like I said before, the one thing about predictions, they're all wrong.
Right. And do you have an idea of how long will this virus, this pandemic, is going to keep attacking our country?
That's a hard question. I've said this before. We are all watching what China does, because once they start relaxing, then we'll know how it's going to spread. Is there going to be a second peak? Is there going to be a third peak? How long do you do this? Because obviously, clearly, we cannot do this forever. We'll have to see. We'll have to see how what China does would be very important to see.
And has there been any science yet or any study yet on will the warmer weather actually help reduce the spread, besides the fact of us understanding and actually applying the principles of social distancing? Do we think warmer weather will help us in this fight?
So far, there's no evidence that it will stop. And if you think about it, Louisiana is still warm. If you think about India, it's very warm, and it's spreading there too. So I'm not so sure this is going to be affected by warm weather as such. But who knows? We'll have to wait and see.
There's a question from one of our and really, look, everybody who's watching, I really appreciate you asking these questions, because these obviously are questions that you want to ask, and we're happy to have a platform here and happy to have someone like Dr. Pradeep on to help answer. So what my assumption has always been, if somebody's willing to ask a question, then there are probably 5 to 10 other people who thought the same thing. So if you don't mind, just share the broadcast, because then that person, that somebody else could then have this access to this exact same knowledge as well. Dr. Pradeep, we had someone who asked about organ transplants, and they said, how do people who have had organ transplants perceive this virus? Is it a greater danger for us?
So I actually looked at this. The problem with organ transplantation is 2 things. Most of the people who asked me this question were donors. If you're let's say you're a kidney donor. If you're a kidney donor, which is your most common donor, if your creatinine is okay, if your residual kidney function is okay, your risk is probably the same as a normal regular person. If your residual kidney function is lower, then you probably are at an increased risk. That is true of any kidney disease patient. If you looked at the study from the CDC, what it showed was the highest risk people were the kidney disease people, which was shocking to me. I thought it would be the lung disease patients, but turns out the highest risk was the kidney disease patients. And I suspect it's because they are dialysis patients. They are much more exposed to these things, Now, how about the people who have transplants? Now, they are at very high risk. Why? It is not because of the transplant as such. It is because of the immunosuppressive medicines that they take, which reduces their immunity a whole lot. If your immunity is reduced, you can think about it. You cannot fight the virus as much. If you cannot fight the virus, you are going to get really sick. So those kind of people, what the advice now is to these transplant people are seen in clinic much more often than a normal regular patient, understandably. So those people are advised to not to come to clinic unless if they can avoid coming to the clinic, that's what they're advised to do.
And Doctor, there's a couple more questions here. One question is, there seems to be a lot of essential businesses open. Do you believe this number could and should be more limited? And I mean, that's certainly a opinion here. Are they all truly essential businesses?
And again, that's a hard one to say because grocery stores are essential. So do you shut down 2 or 3 grocery stores and leave the others open? Or do you have them take turns? 3 will be open this week, 3 will be open the next week. I mean, there's so many things to think about in those situations. What do you do with all those employees? Do you furlough them for a week and bring them back in a week and have them work for a week and then furlough them again for a week? It's a complex question. I mean, and what is essential to one person may not be essential to the other person. So, but you go through the Walmart parking lot, and I went to Walmart today to do some grocery shopping, and there were hundreds of people there. But then I was also one of them. So how can I complain? Because I was there to do grocery shopping. So they all might be there because they had essential shopping to do. And I was one of them, and I took pictures. Right. And then I'm thinking, I'm the guy standing there taking pictures, waiting to walk into the Walmart.
So you took a selfie then, right?
Yeah, exactly. And I'm thinking, oh my God, I'm one of those idiots waiting in line,
So, well, one thing that I've done, and I hope that others, when you think about what social distancing really means, it means going to the grocery store less. It means trying to stay 6 feet away or more from other people that you're not normally around. Like my family, we're around each other. If one of us got it, all 4 of us probably going to get it. But the idea that I might be around your family, for example, we're not around each other. We're doing this remotely. Or Dr. Travis Town, who's on behind the scenes, or Aletha, who's behind the scenes. We're not around as much with each other. So practicing social distancing is good. There is a question here about, are you safe in your own yard outside without contact from anyone?
Absolutely. I don't see a reason why that should be a problem. If you're in, because it's, to our knowledge, it is not airborne. It is by droplets. Now, if it is airborne, that's a different thing altogether. Droplet is you cough, it comes through the droplets or by contact. Now, airborne it's airborne. There's nothing you can do about it, like you see in the movies. It goes, a wind comes through and you get it. So it is not, to our knowledge, it is not airborne. It is through droplets. So yeah, you're sitting in the backyard, you're going to be fine.
I agree. And there was a question about your Walmart. Walmart released on Friday afternoon, and we published it on Saturday morning, that effective Saturday they were going to make some changes. Did you see some of those changes and how many people were let in to the store, et cetera?
Yes, they're actually doing a pretty good job. So there's only one entrance and one exit. They make you wait in line 6 feet apart, which is good. And then there is a lady there who makes sure that if one person goes out, one person goes in. And then they wait for that person to get the cart. The cart is all wiped down and then given to you. So all of that, I think, is excellent. Will it be 100%? No, nothing is going to be 100%, but it is a start. And I think it is a good thing.
And that was the last of the questions I've got. I want to give you a chance if there's anything else you'd like to add before we break away this afternoon.
I always end with this: safe distancing. That is what you have to do. Social distancing. And then there was all these people complaining about not being able to go to church. It's okay. You can sit at home and pray. Justin Barnett is doing the parking lot church. That's actually pretty good, but I want to be sure that nobody gets out of that car. They all need to be sitting in the car, driving back home. I don't want anybody to get out and socialize and then get back in. It doesn't make any sense. That's as bad as going inside the church.
Well, look, thank you again, Dr. Pradeep. Really appreciate you being on again this Sunday afternoon. Thank you for what you're doing. And we saw your daughter peek over your shoulder earlier. Let her know that she's a superstar. We put her on Facebook Live today. Thank you. Thank you again, Dr. Pradeep. Have a great afternoon. Yes, sir.
You too. Bye-bye.
And look, just want to say again, thank you everybody for watching. We've really enjoyed putting on these coronavirus chats. Like I mentioned earlier, we've done, I think, 13 or 14 of them now, and we put them all in a playlist on YouTube if you want to go back. The only thing I would mention is that consider the date that we did it, because just like the information Dr. Pradeep and I just talked about now, in 2 days, it may not be as relevant. And that's a big part of why we've tried to do a bunch of these. And we've tried to do them during the weekdays. I mean, Sunday through Wednesday, Thursday, sometimes at 4 o'clock, to have a little bit of some schedule, some regularity to it. And this week, I will tell you that we've actually got some great guests lined up. There's a conversation that I really want to have, and it is around mental health. It is a conversation that's been that I've been concerned about personally over the last couple of weeks. And so I've asked for a mental health expert. One of our downtown business owners, Beth Sailors, she is going to come on later this week. We're also going to have some information on public school systems and also an update from some of our local health departments. So please, if you don't mind, stay tuned as we make these announcements. You'll see on either our Instagram story or in our daily Neuse newsletter. It's a 7 a.m. newsletter. It's got all the day's headlines. You'll see who our guest will be for that afternoon. So if you want to, you can just subscribe to our newsletter. I think the link was down at the bottom earlier. It's neusenews.com/subscribe. It's free. Everything that we do here at Neuse News is free. Only every once in a while, I'll have people chip in, like to buy a T-shirt or something like that, just to support us. But we want to say thank you to all of our advertisers, all of our sponsors, all the businesses stuck with us through this, so we can provide you this platform. I think our web data has proven that we have more than doubled the amount of traffic to our website over the last month. And we've added close to 300 people to our daily newsletter, and close to 800 people in our text alert system. So I want to say thank you to everybody who's joined, who's participating. Please share this broadcast. And as always, please make sure you wash your hands.